All right, this is Good Morning Nigeria live on the network service of the NTA, and to continue our conversation, very interesting conversation, of course, we've been having in the past 2 weeks, every Friday, brain health for all ages. Let's quickly take an excerpt from last Friday's discussion, and then, of course, we'll get back to introduce our guest. Ibrahim Dan Hamidu has this for us.
The National Health Act 2014 provided for categorization of hospitals according to their capacity. So what is most annoying, based from a practical point of view, is receiving a patient that have visited 3 hospitals before coming to my place, only to find out that it was too late. So if they had come straight, something would have been done. But if these hospitals are already categorized, these hospitals have this capacity, these other hospitals, this is what they have.
Like banks.
Yeah, so you go straight and then you save lives.
When you walk into a hospital, asking to see a neurosurgeon, it means that you are already aware of your problem, and that is excellent.
Okay.
That's excellent. That means you have to go into the surgical emergency, or you go to the general outpatient and tell them you think you have a neurosurgical problem. You will be referred appropriately to the neurosurgeons instantly.
What are the signs? What are some of the signs?
However, knowing the signs is very important. Let's look at the brain, for instance. Outside trauma, tumors, headache. Headache is one of the commonest signs or symptoms that patients present with.
Hospitals or doctors, are still lagging behind when it comes to diagnosis of brain tumor and aneurysm. You see someone always presenting with headache, fever, and the person is on treatment of typhoid and malaria all the time, until the person either dies or, bleeds and then rush to the hospital, and you know what follows. So I am also using this opportunity to call on our medical personnel to increase, to form the habit of when your patient presents symptoms regularly, consistent treatment of typhoid, malaria might be another symptom of that there is something wrong with the brain.
All right, many thanks, Ibrahim Hamidu, for that background report. Let's begin this critical conversation by introducing here Dr. Samaila Timothy, who is consultant neurosurgeon and head of neurosurgery at the FMC here at Abuja. We thank you very much for honoring us again.
Thank you for having me. Good morning, Nigerians.
All right, also here for the conversation is Engineer Chika Okolisa, Executive Director, Brain and Spine Foundation, Africa. Many thanks for joining us, ma'am.
Thank you for having me. Good morning, Nigeria.
All right, so like we mentioned earlier, we've taken this to part 3 because we got a lot of questions from the last 2 episodes discussing brain health for all ages, which we didn't manage to get our doctors to address. And so we are doing this primarily to be able to deal with questions, even as we expect more. Of course, the phone number is on display, and we expect that you keep it short, let your name be there, and possibly let us know who you are so that it's easy to contextualize. Thank you very much. So let's begin, Dr. Timothy. The first one here reads, "Good morning, my doctors. My dad has been on partial stroke for 10 years now, and he is still on drugs till now, and he has started behaving like a child. What should we do?"
The concept of partial stroke in Nigerian parlance, most times when I discuss with patients and patient relations, appears to be related to the degree of symptom, in terms of neurological deficit has perceived by the patient relations or the patient himself, and not really in the real sense of the classification of the types of stroke. Yes, he said the his father had been suffering from
10 years.
for 10 years now. What I would expect or want him to do is to seek appropriate health care. When you sit back at home and expect a miracle to happen, most times it may not. Having said that, sometimes it does, because the deficits following stroke is mostly neurological. And depending on the extent of the neurological insult at the time of the stroke, patient may have some form of recovery. This recovery may be complete or not. But the other associated factors depend on the area where the stroke occurred and whether it was an ischemic stroke or a hemorrhagic stroke. Most times, a hemorrhagic stroke may affect just a vessel in a particular area. It may be small, it may involve a very large area, but a vessel. But for ischemic stroke, it depends on the location of the occluding factor, the blood clot, the thrombus, or the emboli or embolus at the time of the event, such that if it takes a very big trunk, it will affect very large territory of the brain. So even the structures in the brain that are related to cognitive function, intelligence, memory, emotions, feelings, thoughts may be affected. So it is not just the weakness that the person has that the person may manifest with, but the person may also manifest with deterioration in overall human behavior in terms of emotions, cognitions, intelligence, depending on the areas involved. So I think that these patients should seek medical attention, and the neurologist, for instance, may guide the patient as to how the rehabilitation will be. But post-stroke, majorly, medications for primary conditions like hypertension, diabetes, which are taken by specialists such as the endocrinologist, the cardiologist, looking out for why and how the patient got the stroke. Sometimes even neurosurgeons, for instance, patients with carotid stenosis, may undergo surgical procedures to open up the carotid artery, and a surgery we refer to as carotid end atherectomy, to prevent maybe recurrence of stroke, probably the other side if it is ischemic. And then the neurologists working together with the cardiologists, endocrinologists, and neurosurgeons may plan the rehabilitation of this patient. This rehabilitation may include movement to ensure that the patient ambulates well. That is physiotherapy. It may include speech therapy, cognitive therapy. So many domains of function are required in this instance. And I would advise that they should not give up. They should seek medical attention appropriately, and they'll be guided to how and where to seek rehabilitation.
Okay, the next one here, it says, my name is Sandy Levi from Nasarawa Karo local government. I'm a victim of tremors. It has affected every single thing I do as a young man. It has affected my body movement, voice, writing, and my hands. I'm a young man with a 2-year-old daughter. I can't do any job to train my daughter in school. I got sacked due to the tremor. I have been to FMC Kefi. I have conducted brain MRI. I was given some medications to help, but the tremor gets worse anytime I take them. Please, what do I do?
Tremors are of various types, various causes, and various manifestations. It is unfortunate that this patient thinks that there is nothing more to do. I would say that for some persons, tremor may be essential or familiar.
What are tremors?
Paroxysm of abnormal movement of the hands.
What causes it?
There are so many causes. The commonest is essential. It's part of an individual's genetic makeup that as we age, we develop tremors. These tremors are mostly intentional or intention tremors. As we try to do or exert activities with our hands, they tend to shake. Sometimes it could be so mild that it's only noticeable by individual himself. Sometimes it could be so terrible that even a cup or glass of water, is unstable in the person's hands. That is one aspect, essential tremor. In some of them, it may be drug-related, because the centers that control fine movement of the hands, we have the motor cortex that initiates actions. Then we have several areas in the brain that fine-tune these functions. So it is not just enough for the head to tell me, the brain to tell me, move. But part of the brain is telling me move, the other part will say, move it this way. Then the other one will fine-tune it and program it in what we call coordination and balance. So we have the basal ganglia, sorry to go to anatomic terms, we have areas in the brain that fine-tune such movement. Now, as we age, there's global degeneration, as we say, in the body, right? The brain undergoes degeneration, the spine undergoes degeneration, the bone undergoes degeneration. So these degenerations may affect these areas, thereby interfering with their function. So the hands tend to shake sometimes. But then there is a peculiar one people refer to as Parkinson's disease, where certain areas in the brain are affected such that the individual may have tremor even at rest, a peculiar tremor that is referred to as pin rolling tremor. So once you see an individual sitting down, rolling the fingers this way, as if there's a pin there, or the person is rolling something, those are Parkinson's, Parkinson-like Parkinsonism, or Parkinson's disease itself. So now this patient may need further evaluation, probably see the neurologist, work hand in hand with the neurosurgeons, and then classify and know the type of tremor he is having. If it is tremors that are amenable to medications, specific medications may be given. If such tremors are not amenable to medications, I will educate a little that we have an aspect of neurosurgical practice that is referred to as functional neurosurgery. Functional neurosurgery is a practice by neurosurgeons who have dedicated themselves to look at functional problems of the body and treat them with certain medications or non-pharmacological factors. Most interesting to say today is the use of deep brain stimulators. We have neurosurgeons that have in their centers the ability to use stereotactic means, well-coordinated coordinates, well-arranged coordinates, and get to specific nuclei or nucleus in the brain to drop there microchips that will either enhance function or suppress function. In this case of tremor, it will go directly there, sit down there, and then modulate the function of that part of the brain that controls tremor, such that the person will function normally. Deep brain stimulation.
All right, thank you, Doctor. And this one reads, as you are discussing brain issue, I think memory loss affects brain function. Is memory loss hereditary? Is there any cure for memory loss? Also, can hypertension or blood pressure and tension lead to brain damage? This is from Charles Ikechukwu Abiagom.
Yes, hypertension can lead to brain damage. We are looking at an organ that relies on the heart pumping blood to it. Oxygen goes with blood, nutrients go with blood. And the brain takes oxygen and nutrients without stoppage. It's supposed to be continuous delivery, such that even if other parts of the body is not getting, the brain preferentially tends to absorb what the body is getting. For instance, when you eat, when an individual who is so hungry eats, we tend to sleep. Why? Because the body has a way of allowing blood to come down to the gastrointestinal area and pick enough of the nutrients and take back to the brain. So that brief period of blood coming down to take these nutrients back to the brain looks dull and the person will go to sleep because he has eaten. Then he wakes up more refreshed. So hypertension, diabetes, and all other medical conditions that affect the delivery of nutrients and oxygen to the brain will eventually affect the brain. It is like giving the brain persistent insult or recurrent insult. Today is a storm, tomorrow another storm, in the next hour another storm, then definitely brain functions will be affected. Now, when brain function is affected, definitely memory may be affected too, because we cannot predict what part of the brain may be affected. Memory loss could be hereditary. Yes, it could be hereditary, but then it happens again, as I said, as a result of wear and tear. As we grow older, the hippocampus and all other structures that are linked to the memory circuits in the brain, the limbic system, the papier
Does
circuit,
pregnancy and childbirth lead to memory loss?
No, pregnancy and childbirth is supposed to be a physiologic process. It's not a disease condition. God will not give us a process that will be a disease to us. But along the line, because of our genetic makeup, because of existing comorbidities, medical conditions, diabetes, hypertension, and other conditions, pregnancy has to be looked after by the obstetrics and gynecologists to prevent the complications that may arise from pregnancy. But pregnancy on its own and delivery are not disease conditions
for memory loss. Okay.
The
next question says, is there a surgery to correct or stop epilepsy?
Yes. You know, epilepsy, unlike seizure, let's look at it. Seizure is like it may be a single episode of abnormal discharge of electricity or electric activity of the brain, which may be as a result of so many possible etiologies. Epilepsy is still seizure, but this time around, coming frequently, lasting for a long time. It's like a chronic seizure disorder in a patient. Sometimes it can even be predictable. The person will even tell you that it is going to come with an aura. So now, epilepsy, when presented to the hospital, will be investigated. If the etiology is found, surgery may be offered. For instance, some persons think that they are epileptic because they have a brain tumor, slow-growing brain tumor, like meningiomas, which are very, very slow-growing, or some gliomas sitting somewhere. Or they were born with some dysplasias in the brain that affect brain function. Or as we age, some persons may have even mesial temporal lobe sclerosis. The temporal lobe appears to be sclerotic. In that region, those individuals may benefit from surgical intervention. For instance, if it is mesial temporal lobe sclerosis, the person may get a surgery for it. I may not mention names of surgery for now, but that area will be excised. If I'm permitted, I will say that we have things like a lobectomy, anterior lobectomy, temporal lobectomy, like that. We'll take them out. In severe cases, even the whole of the temporal lobe will be taken. In some individuals, the whole of the one half of the brain will be taken.
If surgery is not done for epilepsy,
yes.
Does it progress? Does it lead to...
If an individual has a surgically amenable cause of epilepsy and it is not done, there is no cure. The person will continue to have epilepsy.
All right. Thank you very much, Dr. Timothy. Let's now welcome Dr. Chris Otabo, who has just joined us. Dr. Otabo is the Chief Medical Director at Alliance Hospital and consultant trauma surgeon. We thank you very much for coming again.
Thank you for having me. Good morning, Nigerians.
Now, before I get into the next question, earlier, Dr. Timothy had tried to classify, different kinds of stroke, and how it relates to brain health. And I'm wondering, where do we place Bell's palsy, for instance, in all of this? I ask because of the similarities in, size. Bell's palsy, which collapses a part of the face, particularly, and stroke.
Okay. Thank you for having me. Bell's palsy is not a trauma event. It's an inflammation in a particular part of the brain that affects the nerves that control that half of the body. So once the inflammation resolves, the symptoms will disappear. So it's not a type of stroke.
Can it reoccur?
Yes, it can recur, as long as the factor that made it to occur in the first.
What are the factors that could lead to the inflammation?
Maybe it could be viral infection. Yeah, it could be any other event in the body, but it's mostly temporary and reversible, so to speak.
Does it?
Yes.
Because And I'll use the actor, at least someone who is known. Chidimo Keme said, had something like that. He said he had it, and that he was told he doesn't have cure. That face is still,
Yes, it's not
awkward.
curable.
The smile is gone.
Yes, it's not curable, but it can be reversible. And during the time when the paralysis is on, it's advisable that the individual goes for physiotherapy to keep the muscles active. Because if you don't have physiotherapy when the muscles are temporarily paralyzed, once the muscles lose their strength and loses their fibers, even when the nerve stimulation returns, you're not going to have the muscle being active anymore. Yes.
All right, many thanks, Doctor. I think you would answer the next question. Dr. Timothy will rest a bit. The next one here says, I have this trauma for 3 months now. I experience movement all over my head and slight headache, but most times movements and dizziness. Please help me.
Please, can you repeat the question?
The person is having trauma for like about 3 months now.
What kind of trauma?
And
What does he mean
experiences
by
movements. Movement, well, not
No,
stated.
because you have to understand the concept of trauma. I know the question has already been asked, but let's interrogate the question. Because patients have different terms for different conditions, and they may not be saying the same thing as the surgeon. Yes. So if you say, I've had this trauma, trauma for us is supposed to be an event where there's an impact and there's exchange of forces, and that leads to bodily injury. To the man on the street, trauma could mean that he had a heartbreak and somebody break his heart, and that's trauma. So we have to put it in context, what he means by trauma. I don't know if my own perspective is understood, but maybe we can just read the other formula.
Movement all over the head and slight headache. Most times.
Yeah, movement on the over
as well as
the
dizziness.
Head, slight headache, dizziness. They could be as a result of psychological issues. They could be as a result of terms of lack of sleep and stress. Yes. So we need to understand what has been the problems before that time, and we actually need to understand what he means by having this trauma.
You talked about trauma being when there's an impact and there's bodily harm, but you hear people talk about being traumatized. Say, for example, when they lost someone, or if Victor screams at me now, I could be traumatized. So is that not the kind of trauma?
It's a type of trauma. That's what I'm trying to differentiate. That we as trauma surgeons, that is not within our purview. Somebody can be traumatized, and what he needs is a psychologist. Somebody can be traumatized. What he needs is a behavioral therapist. But when we talk in terms of trauma in surgery, we are talking about something that has caused bodily harm that needs to be treated.
Okay.
So they are different. We can have a childhood trauma. Somebody can see a movie and can be traumatized, but that's not what we
deal
are dealing with.
Okay.
Now,
Great.
this one reads, doctors, what kinds of food can support brain functions? Dr. Tabo.
Okay, so we usually advise balanced diet.
What is balanced diet?
Balanced diet is a diet that contains all the classes of food in their right proportion. So we have the major classes of food, which is carbohydrates, protein and fats. Then we have the other supportive vitamins, minerals, and water and all that. So in the right proportion, and there are food substances and combinations that are generally advised, and it differs from environment to environment. We cannot be talking of exoteric food that is not in Nigeria. Like in the US, if you are going to have a balanced diet, it can be something that has never even been eaten in Nigeria. Yes, so it is location dependent. That's why people who have dietary concerns, they need to get nutritionists or dietitians who will help them plan their diet, especially as people get older. When they are or when they are sick, maybe people with diabetes or other disease condition, because that disease has affected their normal body physiology, and maybe even their ability to process food or their metabolism. So the dietitians or those nutritionists, they can come in based on the food in the environment and based on their bodily needs and their health status. Like for instance, people who are obese, they can put them on a certain kind of diet to reduce calories. People who are diabetic, they can put them on a certain type of diet to reduce the amount of glucose that pours into the blood, and so on and so forth.
All right, Doctor, when you talked about balanced diets, sorry I have to ask this question, based on the present economic realities, does it mean that every meal must be balanced, or you could eat a balanced diet over time? Let me give you an example. Say on Monday you eat beans. Some people, I mean, that could be the meal for that day, and then the next day you're eating carbohydrates. Say maybe you're eating rice, and the third day you're eating vegetable soup. So in the week, when you calculate, if you check everything you have eaten, it amounts to, I mean, eating all the classes of food. Is that balanced?
Okay, so the fundamental is that there is food in the house. It's the combination that is the problem now. Why eat beans the whole day today and eat carbohydrates the whole day tomorrow? Why don't you take part of the beans and part of the carbohydrates and eat today? You still have beans and carbohydrates tomorrow that you can combine. And, so it's just a matter of the right combination. And it doesn't have to be expensive to be balanced. It's just a matter of knowledge. There are some people who, they can put a whole bowl of rice on the table and finish it with just one small meat on top, protein. And they are happy, but they have not eaten a balanced diet. Yes. So you have to understand in terms of what should be there and their proportions. Yes. So when we talk in terms of balanced diet, we are not necessarily talking in terms of being expensive. Cost is not necessarily the primary factor. It's knowledge that's more important in balancing the diet, especially people in the rural areas. They are so blessed and they are so privileged because they are close to nature, and working on the footpath in the hinterland, you are picking so many things and they are very fresh. So if we just have a little bit of knowledge to combine these things, it can help. So balanced diet is good for brain health, but specifically we have to emphasize on things. Because if we are eating balanced diet, really, most of the diseases we talk about, we won't even bother about it. It's only if the diet is not balanced, maybe due to disease or due to nutritional lack, we will now start emphasizing on the things that are important to the brain, like the B vitamins, folates, you understand, and all those things that we know specifically that the brain requires. But these things are present in any balance.
Would you recommend supplements?
I would not recommend supplement except there is a problem. And those problems can come with age. They can come with disease processes. But for the young person who is just, having a good time, he's eating well, he doesn't have any disease process, there's no use for supplement. The supplement industry is a $200 billion a business, and people are making a kill out of it every day, and for most times it is not necessary, and in some instances they are even harmful.
All right,
thank you,
Dr. Tabo. Before we get to Dr. Timothy with the next question, let me bring Engineer Kwolisa in. And from where you stand, do we have nearly enough in terms of advocacy for brain health, and what is needed if for instance, a novice like me wants to be an advocate for, good brain health? What is needed?
Okay, thank you for that question. World Brain Day, this discourse started because of World Brain Day, which took place on July 22nd. And World Brain Day is championed by the World Federation of Neurology. And the intention is to create awareness and advocate and support individuals affected with neurological conditions all over the world. Because they have noticed, or we all have noticed, that brain health has always been taken away from the health discussions for so many years. So the intent is to bring brain health to the center of health discussions. And recently, or for now, we need more voices, to come out and support what we are doing to a lot of people. When it comes to brain, there is this stigma associated with any form of brain condition. Because we have this understanding that anything that has to do with brain maybe comes with madness, and so that stigma is a big problem. You see a lot of, I have tried to encourage a lot of survivors of brain aneurysm, stroke, brain tumor, to come and join us, to even register for an NGO, to come together and then amplify the voices of advocates. But you hear them say, no, I don't want to, please. In fact, don't even mention my name, that I survived. I don't want to, that people will start stigmatizing, people will start running away from me. I say, no, it's not like that. You are a champion. You survived what millions have not survived. Now, when it comes to these conditions, it's better prevented. And there is no prevention without awareness. People have to know that if they don't do this, this might happen. Like Dr. Otabo said the first day we came, he said, brain is time. Time is brain. After my sister's brain condition, I was, I just wanted to know everything about this brain, though an engineer. And I saw this program that was being done by Harvard, and I registered for it. And I went to Boston. I was in that class for neurological emergency. I was in that class, and the professor from Harvard entered. The professor of neurosurgery entered. Immediately he entered. The first thing he said, brain is time, and every other person echoed, time is brain. He echoed it again, brain is time. People echoed, time is brain. And I was like, God, I never knew this. So many people in my country don't know this. In fact, throughout that course, I was just there, because we don't know nothing when it comes to brain. And when I came back, I will enter a bank like this. I will ask 10 people, sometimes more, have you heard about brain aneurysm? What is that? Have you heard about brain tumor? I can't remember. No. But a lot of us are carrying it as a bomb in our brain without knowing. So many of us are treating malaria, typhoid, but they are actually, the cause of their symptoms is actually brain tumor or an aneurysm that is giving them symptoms. So we have a long way to go. And when we talk about advocacy, awareness, it's all about money. It's money. That is why we are calling on federal government through the Federal Ministry of Health. Something has to be done when it comes to awareness and prevention and treatment of neurological conditions. And when we talk about brain health, remember, it's all about brain, spine, spinal cord, and nerves, the central nervous system. So, you don't take one out of the other. For example, I have a patient that is somewhere in this Abuja, and she's 31 years, and she has a spinal cord tumor. Okay? And when these symptoms started, they thought it was just an ordinary pain. And from that ordinary pain, the girl got paralyzed in both legs. And what did the family do? It was an attack, an arrow from the enemy. So instead of going to the hospital straight, they went to a prayer house. From there, jumped to another prayer house. And pastors or, the men of God were taking money from them, taking all their money to pray for them. And while they were doing that, she got paralyzed from shoulder down. So now she can't even move her hands nor legs. She's somewhere here in Abuja. We are waiting for money for surgery because she has a spinal cord tumor, which we have helped some people to treat. But before then, the family said that they did not know something like that existed. And a lot of family, not only them.
Away from awareness, do you think that poverty is also a reason why people seek alternatives instead of medical facilities and medical personnel?
Of course, you will not rule poverty out, you know. To even see a neurologist, to consult a neurologist, some hospitals, they're talking about 50,000. If you go to like government hospitals, it might be cheaper. But the time you waste to see the specialist, oftentimes the patient die waiting to see a neurologist or even a neurosurgeon. I am a witness. I have seen a whole lot. I have tried to help patients get an appointment. Yes, thank God, I'm so happy for neurosurgeons, neurologists that pick my calls even in the middle of the night, rush to hospital to save life. I'm so honored to have that privilege. Even sometimes doctors call me to see how to, assist them in reaching a particular neurosurgeon, which I don't take for granted. So, but a lot of people who don't know that that we exist, okay, they don't even know they don't even have an option than to queue up while the patient is dying. Brain is time, remember? And when it comes, it's either not, if the person doesn't die, the prognosis gets worse, okay? And once it gets worse, because it has to be, this time of degeneration, it's also, when even there's a treatment, it takes time for recovery. And that time is something that a lot of families don't want to wait for. Now, last time we came here, I said that a mother called me that her child was unresponsive and there was no bed in the hospital, all that. Now that patient she has a diagnosis of cerebral malaria, and it's a very strong one. Now she's receiving treatment. The family, the bill now is almost 700 plus, 1,000. They're looking for money. The child is having time, it's taking a lot of time. She's not seeing, she's consistently crying. But the prognosis is getting better, but the parents are worried. And doctor has told them that your child will be okay. She will see again. For some, it will take 1 month. Some, it will take 6 months. For some, it will take 1 year or more. The child is no more seeing. But it will take a lot of, some time for the brain to resolve.
Has the child been cured of the cerebral malaria?
She's receiving treatment.
Okay.
And she's getting better.
When you were speaking, it's something just prompted in my head. You were talking about the malaria and typhoid diagnosis for a lot of patients. Would you say that even in the health sector in Nigeria, there's a deficit? Maybe personnel, because some people present with some of these symptoms. They go to hospitals and then they instead of doing MRI or whatever, they tell them go do malaria and typhoid. And again, like we've had on this program, we've talked about malaria and typhoid, wrong diagnosis and all of that. It's medical personnel that will prescribe that, it's malaria and typhoid that you have. And each time they go, that's like the same thing, except the patient is probing further. So don't you think that that's also a gap? In some parts of this country where surgeons, neurosurgeons are not available.
That is a problem. It's a big problem. For example, I traveled sometime last year to my hometown, and I learned that one of my aunts had a stroke. And I was like, okay, it's time for me to even see how they treat stroke. It's an emergency. And I rushed to the hospital. The particular hospital is owned by a pediatrician, okay? But he's a professor of medicine. And in the room where they were, I saw 3 emergency patients. They all had stroke. But before I could get to my aunt, there was this patient who was breathing, with all the strength in her. And I had to stop. I asked those that were standing behind, just beside her, say, is their mother that she suffered a brain hemorrhage on the 25th of December. This was on the 7th of January. someone that suffered a brain hemorrhage on the 25th of December, what is she doing in hospital that is not no neurology, no neurosurgeon on the 7th of January? And I became angry. I went back to the doctor. I said, what's happening? The guy was trying to draw me, just away from the family. I said, no, this is not good. This is not good. We can't be doing this. And other patients there, they had stroke. There was no ventilator. That woman was supposed to be in a ventilator in an ICU. So I asked, where is your ICU? There was no ICU in the hospital. That particular room was the ICU. I said, where is no ventilator, nothing? And I became angry. They called the owner of the hospital. They almost tried to, call police for me. I said, it doesn't happen. It will not happen. So my brother had to take me away from the hospital, but we came back. But before we left, I told the children of the woman, I said, please run for your mother's life. There is no help that is coming here. Your mom needs a neurosurgeon immediately. And that grace period is already going. Do something. They were like, where will you get one? I said, go to Nnewi Teaching Hospital, or you go to Enugu.
Which is very far from where they were,
They were in Nnewi.
Okay.
Okay, so, but before we came back, the woman had passed.
All right.
This is all about information is important, because there is also neurosurgeons in Nnewi, but information, when families don't have when people don't have information, they are like incapacitated.
But the doctor was taking advantage of them by keeping them in the hospital when he doesn't have.
A lot of doctors are guilty of this.
All right.
Yes.
All right. I hope that note is taken anyway. Now, Dr. Timothy, this one reads, my father had a fall around March. Until now, he presents with amnesia and lack of speech coordination. He's also not been able to walk since then. Please, what do I do? May I also get the numbers of the doctors in the studio? Well, that's from Chiebuka Rema in Asaba.
For elderly patients or persons or the senior citizens, a fall, no matter how trivial it is, could be so damaging to the brain. I will still take us back to recall that...
A fall with impact on the head?
Yes. No, with or without impact to the head.
Oh.
That's why I want to take us back. I made an analogy here of a fresh granite in its shell and a dry one. If you recall, I didn't complete the reason. The reason why I made that analogy is that when the brain in a young person is of a very large capacity, filling the skull. Now we have what we call bridging veins, the veins that drain blood from the brain out. They hang on the surfaces of the brain as they deliver the blood to the sinuses, which are just beneath the skull. Now imagine the brain of an elderly person. It's already shrunken to some extent. So the veins become prominent and are hanging. So they tend to support the brain, sort of this way. So any slight motion that is beyond the elastic limits of the veins will cause one or two veins to cut. When that happens, they tend to bleed. Now, because this bleeding is venous bleed, the blood accumulation is slow around the brain. And because the brain is already shrunken, the capacity of the space around the brain is large. So it takes time for clinical symptoms and signs to manifest in them. So this very person who had impact in March and now is becoming sick, unable to walk, may just have collected blood in the brain, in a space that is referred to as subdural space. So this man may have chronic subdural hematoma. If allowed to progress, he may be found unconscious one day. But if he presents and a brain scan reveals chronic subdural hematoma, the surgery is gratifying. It is one surgery you do today, in 2 days' time the person goes back home. And the symptoms most times are completely reversed.
How much would that surgery cost?
It depends. In government hospital, maybe in total, I won't say in total, what the person may require to go to theater and out may be like $1 million.
Okay. $1 million isn't just $1 million. Let me get to Dr. Otabo now.
No, because
the next question.
He's going to get a scan of about 100,000, 75,000.
No, you
eventually-
said what the cost is. It's not a problem, but we are just saying, this is part of the issue.
It's more.
Aha,
It's more than $1 million.
More.
So if $1 million is not just, so more is.
More.
Anyways, I don't have the words, but let's get to Dr. Ota. But the next one says, doctors, what is the cause of this constant pain in the head, particularly to the side and back of the head? That's from Mr. Solomon in Orozo in Abuja.
Okay, so there are many reasons why someone can have pain in the head. Most of the time, the pain is coming from outside the skull, not inside. Yes, and one of it is cervical spondylosis, which is degeneration of the spine around the neck. Yes, and so the nerves that are coming out in between each bone of the spine is compressed, and that compression can give pain in the neck that can radiate to the head. Yes, and muscle spasm around the neck can also cause that kind of a pain. Then commonly is stress. There's what we call stress headache, where you have, just dull pain, around radiating from the neck down to the head and all that. Then there could be some other hidden things, maybe some form of tumor or other conditions, maybe some other degenerative conditions can be there. So it is not specific. We have to evaluate the patient, but the commonest in my experience is the degenerative condition of the spine that radiates to the neck, followed by stress that can lead to stress headaches and all that. But if that pain persists for some time, then a scan is required, because also,
To be sure.
yes, headaches can be as a result of situations within the skull, which could be a tumor or bleeding in the brain or even aneurysms. So it will be both intracranial and extracranial. But the extracranial causes are more common, maybe 1 to 10 or thereabout. Yes, but if something is happening within the brain, it's usually a big deal.
All right, thank you. And my name is Favor, and I am 21 years old. Please, I normally feel heaviness of the neck for about 4 to 5 years now, and I don't know what to do. Please, doctors in the studio, what could that be, and what should I do? Dr. Timothy.
Yes, heaviness of the neck may be primarily a neck problem. It could also be from the head, for instance. The tension headache described by my chief sometimes may be felt down to the neck. So you go out for daily activities, you come back home, you have some headache, stress headache, tension headache is what we refer to it. You feel it down there in the neck, as if you are carrying heavy load. That's not a problem of the neck, it's the problem of day-to-day activities. Then, computer users, you position yourself in your office, maybe with the computer looking towards lower than the face. So one has to look down most times while working. For the period of 4 years, if one is in the same office doing the same thing day in, day out, the person will continue to have the same complaint day in, day out. Why not get a very good seat with lumbar support, sit erect, keep your face straight, look at your laptop up front, and then do your work. And from time to time, take 1 minute, 2 minutes off work and relax the neck and come back. But then, if this heaviness in the neck is associated with some radiation of pain towards the shoulder, towards the upper limbs, then it becomes more sinister. perhaps the heaviness is just dull, aching pain that is sitting right there in the neck. And it may be associated with slow-growing pathologies, such as schwannomas, arising from the nerves, the covering of the nerves, and then sending certain pains down, and then here the person feels it like heaviness. Then, depending on the age of the patient, spondylosis. Patients who are developing cervical spondylosis, which are degenerative changes that occur, in the neck, affecting the bone, the disc, the ligaments, the tendons, and the muscles around the neck, may give such kind of heaviness. And it may be early, so the person may not have other symptoms, like radicular pains that come down to the digits. So the person may think that it is just dull pain coming from day-to-day activities, but it may not be. It will be cervical spondylosis. Now,
the pain that comes from day-to-day activities, can it lead to other complications?
Of course, it's already a source of discomfort. Now we're looking at, let us look at brain health now. The structural health of the brain and the mental health, mental health, right? The psychological health, all those classifications are there. If a particular item or object becomes so persistent in somebody's life that it becomes a thing of concern, that concern is sitting in the particular domain of the brain, emotion, feelings, fear and sadness. That affects the mental health of the person automatically. The person becomes worried, anxious, and will live with fear of unforeseen doom in future. So it affects the quality of life of the individual.
Many thanks, Dr. Timothy. We need to pause now, and when we come back, of course, the conversation continues. Remain tuned.
Major currency unit is the Naira, while the minor unit is the Kobo. They are both in notes and coins. The Naira is more than just a medium of exchange. It bears the images of our heroes. So, stop abusing the Naira. It is a criminal offense to spray the Naira at events. Stop stepping on the Naira. It's not your enemy. Do not squeeze, ruffle, or write on the Naira. Handling the Naira with dirty or oily hands can deface the Naira. Love the Naira as you love yourself. Be a real Nigerian. Do not abuse the Naira.
We can change the narrative about Nigeria. When people talk about Nigeria, they talk negatively about it most of the times. So it's the role of the filmmakers to now bring that positive side of Nigeria for the world to understand that Nigerians are more than the negative information they used to get. And we can do that digitally, because in those days, you have to communicate or go for lectures for people to understand where you're coming from. But now you have these platforms. Everything you have can go on these platforms. People will see globally. Look at Nigeria on Netflix. It's doing really very well. When Nigerian films premiere on Netflix, you find out that they're in the top 5 or top 10 in most of the European countries, Asian countries, and all other parts of the world. So this is one of the ways through which we can be able to export that, or do that cultural exchange.
How much of being a Nigeria cultural ambassador are you? And we're all guilty of this. Most of us Nigerian filmmakers are guilty. So here we see a good number of us telling stories that are still Western culture dominated. From the naming of your characters, from the writing of your story, the characters are named English names. What happens to Yoruba names? What happens to Hausa names? What happens to Igbo names? What happens to Tiv names? What happens to our cultural epic names? Oh, they say, but they will not be able to pronounce it. Oh, leave that to them. Do we pronounce their own names? We have to be intentional about how we represent our culture, knowing now that the world is a global space and you don't need people's permission. Everything you do, directly or indirectly, intentionally or unintentionally, you're putting the Nigerian story out there. I think we should begin to make conscious attempts at creating our own streaming platforms. So we thank God for giant streaming platforms like Prime Video. We thank God for giant streaming platforms like Netflix and the rest of them. But what happens if today or if tomorrow we come up with our own Nigerian Netflix?
The Nigeria Coat of Arms is the official seal that represents the authority of the Federal Republic of Nigeria, hung on the wall behind the seat of the principal officer of the government, supported by the portrait of the serving president of the Federal Republic of Nigeria. It has 7 features. The black shield stands for Good Earth of Nigeria. The silver wavy band stands for the confluence of rivers Niger and Benue. The 2 white horses stands for dignity. The yellow flora is a common wildflower throughout Nigeria. The red eagle stands for strength. The wreath is in our national colors of green, white, green. The motto, unity and faith, peace and progress, is written on a beautiful yellow ribbon, and it's a maxim for all Nigerians. Be a real Nigerian.
All right, many thanks for remaining tuned. It's a Good Morning Nigeria live on the network service of the NTA, and we're discussing the final part of the topic, brain health for all ages. The doctors are still with us, and of course, Engineer Kolisa is also right here. We've dealt with quite a number of questions sent in by our viewers, from the first and second episodes of this program, and of course, I'm sure we have done justice to that, and I'm sure our viewers appreciate us for this. So we'll get back to some other questions that we have for our doctors, and of course, we'll rounding off the conversation. So I would like to get to Dr. Timothy as we round off. I mean, so much has been said. I've learned so much about, the brain, how it functions, and then if there's a case of an emergency. But in your own view, what really is lacking in the country, in terms of managing, conditions of the brain that would require medical attention?
A lot is lacking. Awareness is key. You may have the facilities, you may have manpower, the personnel, the expertise to operate in the brain. But if the patients don't come to you, you can't help them. Once I met a patient that said, please, Dr. Timothy, let everybody that has my own kind of condition know that they have the condition. And this is because I met this patient in a village hospital, for instance, in a particular state. So I asked myself, the patients in this state and some other states where there are no neurosurgeons, to even tell them, this, how do they get to know that they have a particular medical condition? I have seen patients with brain tumors that came to me at the time that they were dying. They were dying. There's nothing one could do. Just scan the patient, and then the patient is going. So awareness is key. So we must get the government machineries that are saddled with the responsibility of awareness to get this awareness to the grassroots. National Orientation Agency, if I'm permitted to mention names, should have jingles like that. Federal Radio Corporation should have jingles on brain and neurological conditions, especially Federal Radio Corporation, NTA and Co. should have jingles coming on, from time to time, maybe sponsored by national orientation agencies for awareness. Then in our hospitals, Abuja is not like other places. In Abuja, we have 1.5 Tesla MRI machines in almost all corners. And then even private hospitals have them, CT scan machines. In fact, people are moving from 16 slides to 64, 32, 64. Some people are going to 128 slides CT scanner in Abuja. But even 4 slides CT are not available in some states. Just to scan the brain and know what is happening, so are available. So, budgeting. Government hospitals should budget relevant equipment and push for financial support within the limit of the budget to get this thing done. Even if they are expensive, they should be taken in piecemeal by government. Government can do that by centralizing. If government takes a hospital in a state this year and equip it for that state, and then another state government is doing that for its own state, just one hospital per state, per year, all the states will have a standard hospital that can take care of neurological conditions. What do we need? Very simple. Dedicated theater, because of the sterility, of course, that we require to open the brain and spinal cord, brain MRI, brain CT scan, and then basic equipment. It's okay. That's what we need to save Nigerians. We are not asking for high-end technology like the deep brain stimulation I was talking about, stereotaxis, neural navigation, microscopes that cost more than $600,000. Those are not what we are asking for. We are asking for microscopes that are as cheap as 120 million, 50 million, 60 million, even refurbished ones. In my hospital we have, it is helping us, but not everybody, every hospital has. So government should look into furnishing our hospitals for neurological conditions.
All right. Thank you, Dr. Timothy. When he said as cheap as 150 million, I pinched myself, if that is as cheap as they come. But Dr. Tabo, how can we drive down the cost of brain-related ailments for Nigerians? Because at the end of the day, no matter how early you find out, no matter how early you act, if the resources are not there, there's nothing you can do about it.
Yeah, I agree with you. Anywhere in the world, brain is expensive to cater for. That's the truth. And as high as the cost is in Nigeria, it's still one of the cheapest in the world. That's the truth. But not everybody is a millionaire out there being able to attend to their brain health when the need arises. Those people out there, they have support systems that help them to cater for their health when the rainy day comes. And that's where health insurance comes in. Unfortunately, we are still at the baby stage in health insurance. Even the national health insurance scheme that we say is just less than 10%. Or all the insurance in Nigeria, health insurance in Nigeria is less than 10%. When it comes to brain surgeries, the national health insurance, they chicken out because it is not covered. So we have problems in terms of scope of coverage as well as volume of coverage. Yes, so that's an issue. We have to do something. The National Health Insurance Authority just have to think outside of the box to get as many Nigerians as possible to be covered. Not just to have their names on their register, but to increase the number of items that can be covered under that scheme. Then also, organizations like what Engineer Chika is doing, fantastic. She's such a wonderful person. She's now, her voice is now beginning to resonate in sensitive places, and people are now people's attention are being drawn to the problem. So the non-governmental organizations can play a key role in terms of mobilizing funds, in terms of even creating the awareness, and in terms of interrogating the government to ensure that government part with something for this critical sector. Yes, so abroad there are philanthropists, very wealthy people who have suffered one form of brain trauma or the other, and they survived, and they have billions. You can just donate $1 billion and say it's for anybody with neurological conditions. So that's what we are not seeing a lot in Nigerians. A lot of Nigerian billionaires just die, and their money becomes a problem for their family. People fight over their monies. It's when you are alive that you can determine what you want to be remembered for. If you are so wealthy, let your money count for something. Let it go beyond just me, myself, and I, or my family. You can endow some funds. You can create a trust fund where this is what I want this money to be. Look at we talk about Nobel Prize today. I mean, Nobel, the gentleman that created that fund, he was a wealthy man. He put the money there. Not just that he kept the money somewhere. He put it in an investment. Whatever comes out from that investment will be used to fund this prize. And it has outlived generations. So Nigerians, this is how to immortalize your name. If you are wealthy and you want to make impact, look at what you don't have to take all the problems in the country. You can look at one angle. If it's medical education you want to face, one dear elderly woman, 91 years old or so, in New York, Bronx University, she donated $1 billion to Bronx University. It's a poor neighborhood, a lot of black guys there. Because of that $1 billion that she donated to that university for medical students that go through that university will not pay a kobo for school fees.
Wow.
For generations to come. So that's the kind of things that we should encourage our rich men to do. And government can actually take the lead. Government may not have funds, but they have goodwill. Mm-hmm. Yes, and their goodwill can be converted to funds. Mm-hmm. If government can call some of these big guys and say, guys, like for instance, the Super Falcons that want stuff, a lot of people were grumbling that why would government give them that kind of money? But you know that government does not have to bring that money. If they call some rich men and say, please, let's help these people, and no matter how much they give them, it's not government money, and everybody would have been happy. That kind of thing, you call rich men, put them together and say, look, we'll put your name in gold in so place. Please, can you support this? And a lot of people would do that.
I was hoping that...
So we need leadership. We need pragmatic leadership from government to be able to solve problems without necessarily having the money.
Many thanks, Dr. Otabo. I was hoping they would give you like 3 more mics to say what you just said so that it would be louder. Because, I mean, to take away, I mean, you see a lot of things, burying money under the ground, GP tanks and all of that, and all of this can actually save lives. Many thanks, Dr. Otabo, for that, and I hope that someone has heard you. Dr. Okolisa, Engineer Okolisa, as we begin to round up the conversation, speak to health professionals. Because, I mean, from what you said, you shared an experience. We have medical personnel who are taking advantage of patients. They know they don't have the cure to the issue. They know they don't have the facilities, but they keep them in their facilities just to milk them. So what can the NMA do? And what will be your advice, to health facilities, that are not properly equipped to deal with certain conditions?
Okay. I'm appealing once again to the medical professionals, the healthcare professionals. A lot of times, I have also noticed that some of them do not even know. These issues we are talking about, brain health issues, some of the times I have come to realize that some do not know. So we have to invest in training the workforce. It's not just the neuro professionals. I think that Federal Ministry of Health has a lot to do when it comes to neurological conditions, when it comes to helping Nigerians with neurological conditions. We will not forget that neurological conditions or brain health conditions is the major significant contributor to disability. So, both visible and invisible disability. Most people with brain health conditions have disability that we do not see. They have disability that they will live with, through their life course without nobody knowing, but they have disability within that people do not see. So we have a lot to do, starting with primary health care. We have to invest, not just talking. We talk too much in this country without doing so much. And we hear a lot of funding being pumping here and there without seeing it, translate to something, meaningful, something that we can see. If you visit our primary health cares, you can't even sit in some of them. It's also good to know that, yes, Federal Ministry of Health is trying to upgrade some of the centers, but the majority of centers are not getting attention. And the people that are there are the ones that are suffering. A lot of healthcare workers are also not encouraged enough because of there are so many issues to treat. And when it comes to funding of neurological conditions, it's something that we are yet to, get attention at. It's money from the diagnosis alone, to see a neurologist, like I said before, it's money. To get CT scan or MRI, for those that are lucky to have such opportunity, it's money. Then to get the treatment done, it's money. Then for some of them that have already have deficits, to get rehabilitation, it's money. To manage, it's money. I'm feeling emotional. We have a lot of patients in this Abuja. I'm not talking about outside of Abuja. We have a lot of patients that I don't know how they sleep. It affects the whole family, the whole community. You see mothers, they carry their children because they don't even know what, some of those things, they can't even afford medication, not to talk about rehabilitation. And we can do, we can't do much because there is no resources. That awareness, the prevention, we have to work and invest in it. To prevent is better, is the best, because we are not ready. We are a country of 250 million or even more. And we are talking about 150, 200 neuro professionals. We're not even talking about neuro nurses. Where do we have neuro nurses in this country?
All right.
You see, no, let me finish, please. Just 1 minute. You will see a neurosurgeon stand for 9, 10, 12 hours, do a surgery, do a perfect, successful brain surgery. And after 2 days, 1 day, the person dies because there is no skilled workforce in that theater, in that ICU, to take care of the patient where the neurosurgeon stops. And we can't continue like this. I'm talking about urban areas. What is happening in rural areas? There is so much. We are talking about we don't have money. We have money in this country. We have money. We have to do something to help our people.
Thank you. Thank you. I appreciate the passion that with which you do your work. Thank you very much.
Passion
but
and
as we gradually wind down this program, Dr. Timothy, what can individuals or families and communities do to support individuals that have neurological issues, brain-related challenges?
I encourage Nigerians, families, friends to show love to families of persons with neurological problems. With love, there will be support, social support, financial support. Encourage them, give them knowledge, guide them to where they will get help. Pull resources together. What I tell patients sometimes is, or patient relations, is your church or mosque aware of your problem? Have you informed them? Is there no pool of money somewhere they can pull to just help you? If you are not getting from anywhere, non-health insurance for you, can't you go there and see? You can even borrow. I don't encourage people to do that, but when it is necessary, you can take little money somewhere and see how communities will help you pay back to get help, if it is necessary. So I encourage communities not to stigmatize, but to support.
All right.
To show love, to show kindness, passion, contribute. Your little 10,000 naira, 5,000 naira, 200 naira may take this patient somewhere.
Thank you so much, Dr. Samaila Timothy. At this point, I want to say thank you to our doctors that have been with us from the very first edition of this program. I mean, coming here every week to talk about this. God bless you, and of course, we appreciate you. To all the doctors who are doing the right thing, saving Nigerians, and have decided to remain in Nigeria, of course, God will continue to bless you. I would like to appreciate Chief Medical Director, Alliance Hospital and Consultant Trauma Surgeon, Dr. Chris Otabo. We see what you're doing. Thank you so much.
Thank you for
and may God bless you. Dr. Samaila Timothy, Consultant Neurosurgeon and Head of Neurosurgery, Federal Medical Center Abuja, Head of Surgical Emergency, FMC Abuja. Thank you so much, Doctor. We do sincerely appreciate you, and may your wisdom continue to grow.
Thank you.
Engineer Chika Okolisa, Executive Director, Brain and Spine Foundation, Africa. We pray that you get all the support that you need to continue to help patients like you have been doing. Thank you so much for being our guest this past 3 weeks. It's been a very, very interesting edition, mixed with all sorts. I'm sure you enjoyed every part of it. I'm sure you've learned something. And to families going through, families going through one or two or any kind of medical condition, we hope that you get help, and we hope that your relative or whoever it is recovers as soon as possible. So that's where we round off this very interesting topic, talking about brain health for all ages. May our brains continue to function properly, and of course our health remain perfect. I'm Henry John. That's package this Friday. Remain tuned to the NTA and have a great weekend.
And I am Victor, as we will see you again on Monday. Bye-bye.